Ketamine's history dates back nearly 50 years ago when it became a mainstay in anesthesia. But the drug developed a very bad reputation as a dangerous party drug. But the drug's off-label use to treat depression is trending, and with zero regulation, there's no shortage of clinics offering this treatment. So Dr. Mendel, why was it so easy for me to pop into these clinics and I was offered these treatments right on the spot?
I would suspect it has something to do with cash flow.
Today we're bringing you inside the world of ketamine and the clinics offering it as a medical treatment. Now there's a ketamine nasal spray to treat depression, but the question that we're uncovering is it being abused? Is it being prescribed too prolifically? I want to ask you, because you mentioned in our briefing that you were actually offered these nasal sprays.
The FDA just approved a nasal spray for depression, a ketamine nasal spray, but it's expensive and it's only supposed to be used in a supervised doctor's office setting. Now, I think the clinics I went to found a workaround, which is they offered me a prescription for a generic ketamine spray and said I could take that home with me. Now, I just happened to be at a house party and I saw people using a ketamine nasal spray, not for depression or what it's indicated for, but to get high.
And Leslie, this preparation was being made in a compounding pharmacy.
So let me ask you really quickly, Dr. Mendel, what is the dosing of these ketamine nasal sprays?
I don't give ketamine nasal spray.
Okay.
I don't think that's a good therapeutic use, although the S-ketamine that's available, approved by the FDA, has been fairly effective. It's nowhere near as effective as intravenous infusions. The dose that we were giving when I tried nasal sprays 4 years ago was about 70 to 75 milligrams.
So if you're talking 70, 75 milligrams and you're taking multiple hits of this, it could theoretically give you a high. And let's dig a little deeper into this, because joining us now in our medical confessional is Jeff, who admits to using ketamine to get high. And Jeff is in the medical confessional because he desires to remain anonymous. Jeff, have you used these FDA-approved nasal sprays to get high, and if so, how?
Yes, I did. You know, I heard about it from my friend, and he had tried it several times, but it was administered by a doctor in his office through an IV. And he showed me the prescription bottle of nasal spray. And he also said a lot of good things about his experience with it. And based on everything, I was, open to trying it.
So Jeff, I'm just curious, what is the effect when you take this nasal spray? How did it make you feel?
I just immediately felt this crazy rush through my body, and it definitely felt psychedelic. It was like psychedelic cocaine.
And how long did that effect last, Jeff?
I would say it did last about 30 minutes, that feeling, but I felt the effects for about 3 hours.
Dr. Sportelli, it seems to me that making treatments more accessible is a good thing, but all I keep thinking of right now is the opiate crisis. It just keeps ringing in the back of my head like, oh my gosh, we're trying to help people, we're trying to make really, at times, effective medicines more available, but they have the risk of abuse. What are your thoughts with this?
The FDA-approved version of S-ketamine is incredibly regulated, which means this: if you want to be an intranasal provider of S-ketamine, you have to undergo what's called risk evaluation and mitigation strategies. That means you can only give this to the proper patients that have been diagnosed appropriately and documented. It comes from a certified pharmacy, there's informed consent, and there's ongoing monitoring, and it's only given in the office twice a week. Let's just get that out of the way. The idea of giving someone a take-home nasal spray of ketamine with a behavioral health issue is the absolute worst idea I've ever heard in my life, and I'm going to tell you why. People with behavioral health problems by nature have a higher likelihood of addiction and abuse. If someone has bipolar disorder, they have a 7-time more likelihood of abusing a substance for self-medication. Now think about this. Ketamine is a fast-acting, short half-life medicine, which means it acts quick and goes away quick. Could you imagine trying to give that to somebody with a behavioral health issue that's depressed? What do you say? Take a squirt whenever you feel down? I mean, this is absolutely setting somebody up for complete disaster.
Look, I want to be honest with everyone. I started using ketamine in the emergency department for conscious sedations, and it was incredibly effective. Yet, if I ever give it to a patient, they are on a monitor, and I am observing every vital sign, making sure their airway is patent, just like you as an anesthesiologist. So when I started hearing about ketamine being used this prolifically, it scared the out of me. And yet now I feel like we're talking about it, well, this dose is perfectly benign. Can you talk a little bit about this concept of microdosing? Is it benign? And where do we draw the line? Because it seems to me a drug that I treat with so much respect as a trained physician, now people are using it out at parties.
No, it's completely insane. But let's talk about the microdosing. Obviously, what we're doing now for depression is basically considered microdosing, right? Yeah. And Dr. Mandel will agree. You're using about 0.5 milligrams per kilogram, where in anesthesia, you're using 3 or more milligrams per kilogram. So you can tell it's already a very, very tiny sub-anesthetic dose. So that really is considered microdosing. But regardless of the fact, they shouldn't be doing this by themselves. They shouldn't be self-administering ketamine, right? So daily microdosing is a very bad idea. It needs supervision regardless.
What are the risks of addiction with this medication, and what are the long-term side effects if someone is abusing ketamine?
Well, the good news is that most of the research shows that if ketamine is given appropriately, and that means following the APA guidelines that were put forth, following like university health standards up in Canada, that sort of protocol, the studies show that the risk of addiction is very minimal. However, we absolutely know that people will abuse ketamine because it's a dissociative. A dissociative means you kind of leave reality for a little while. So it's the perfect addictive substance for someone that's suffering from a psychological issue. If you're at home and you need to escape, you know what? You take a squirt of ketamine and everything goes away. It disappears. So long-term use, we know that it affects memory in a negative way if you're using it and abusing it. And listen, I got to say something else. You know, in psychiatry, I often hear this insulin comparison, and Dr. Mandel had brought this up, and I respect everything that Dr. Mandel is doing, and I give him a ton of kudos for, you know, trying to regulate this, because that's the most important thing that we have right now is regulation, because this is a promising treatment. But we're talking about a medicine that people feel when they take it and feel when it wears off. This is how I look at treatment-resistant depression. You are in the middle of a storm, and you cannot see the way out. Ketamine gets you out of that storm for a few weeks, maybe a month, maybe longer. And in that time period, you can put together collateral resources. You can start therapy. You can get back to work. You can start cognitive behavioral work. You can see therapists. You can talk to your family. You can get going again. You can start going to the gym again. It gets you out of the storm. I don't think that this should be promoted as something that you're going to need to be on for the rest of your life, and you're going to have to keep coming back to the ketamine clinic to getting monthly boosters. That's just my opinion. I see too much of a correlation between benzodiazepines, stimulants, opiates. I think it can get you out of the storm, and that's where we need to keep it for now until further research is done.
Well, and these are all wonderful points. Unfortunately, we are out of time. Jeff, I want to thank you for opening up about your experience, and Dr. Mandel, thank you for sharing your experience in your clinic, and certainly Dr. Sportelli. Look, I think everyone now realizes the potential for abuse. We're going to have a list of information on our website. If ketamine is a treatment that you've ever considered, we're going to have sort of a list, a checklist of things to look for so that you can go to a reputable place. And also, remember, unlike Leslie, who is doing this just for an investigation, you should not be rolling into a ketamine clinic and saying, hey, I want to try this out and making up symptoms, because it could be a drug of abuse. It could be dangerous. And Leslie, that's where I credit you. You keep doing these investigations where you are quite literally proving that the only purpose of a lot of these things or these clinics is to make money, and they don't care about you. And so make sure, especially if you have a mental health diagnosis, that you are in the hands of someone who truly cares about you and your well-being. So very well done.
Thank you.
Excellent.
More to come.
Coming up.